your question. Once you have read this, there's 2 lines on the next page.
Yes, ma'am.
Okay, just little bit is on the other side. Question and the chart. Right, so if you have read and understood, considering the critical care scenario, kindly tell me, how would you manage this patient?
Considering the scenario, I will first manage the patient according to PRIS protocol.
Yes.
I will start with ABCD protocol,
Okay.
and after taking a full history of the patient
Yes.
and examining the patient, I will start aggressive rehydration of the patient first.
Okay.
And
what else would you do? Yes.
And as patient is in severe pain, I will give analgesic to the patient according to WHO guideline. And if if needed, I will admit the patient in HDO or ICU setup. And according to the scenario, my provisional diagnosis is patient
No. First, I asked you management. You just tell me the important management points that you will take care of. Then we'll move on to. Or okay, we'll come back to that. All right. Considering the scenario, what are your provisional diagnosis?
Considering the scenario, my provisional diagnosis is acute pancreatitis.
Okay. What are the other differential diagnoses that you'll consider?
Yes, ma'am. It may be as there is no previous history, but I will take the history if a patient has any severe attack previously or not.
Yes.
If there is a previous history, then it may be acute relapsing pancreatitis, and it may be acute cholangitis.
Yes. Acute cholecystitis.
Acute cholecystitis maybe.
Perforated viscous maybe. Okay, if we just think of the provisional diagnosis that you are considering, what might be the causes behind it?
The possible causes may be gallstone.
Okay. Yes.
Gallstone.
Yes.
Maybe alcoholism.
Yes. Infection.
Infection. Yes, ma'am.
Trauma. Any trauma?
Infection. Yes, ma'am. Trauma. And
any post-operative procedure if it has
any iatrogenic cause. Yes.
Yes.
Any iatrogenic
Okay.
cause.
Can you please tell me, considering your provisional diagnosis, what is the pathogenesis behind it? What does it cause? What causes pancreatitis?
Ma'am, if there is a gallstone, it may be due to duct obstruction.
Yes.
And reflux of bile into the pancreatic ducts that may cause that may increase the intraductal pressure.
Yes.
And ultimately cause damage of pancreatic acinas.
Yes.
And it may lead to leakage of pancreatic enzymes that cause further damage to pancreas and release of pancreatic enzymes.
Yes,
and there may be direct injuries also.
Yes, which causes fat necrosis, etc. Yes.
Yes, ma'am. There may be direct injuries to pancreatic cells also, like due to viral cause, like mumps, or any drugs like thiazide diuretics. And
can you please tell me how would you confirm your diagnosis?
To confirm my diagnosis, I'll first check the liver enzymes. I'll first check the pancreatic enzymes, serum amylase and serum lipase. as
Okay.
patient has raised serum amylase.
Can
There may be
you
suspicion.
name any criteria that can help you establish your diagnosis?
Yes, ma'am. There are several criteria like Glasgow criteria and Ranson's criteria.
Okay.
Glasgow criteria. May I mention the criteria
Yes,
also?
yes, please.
Glasgow criteria include partial pressure of oxygen less than 60 millimeter mercury, age more than 55 years. That's not in this criteria. Patient has 47. Patient is 47 years old, and neutrophil count will be more than 15,000, and
Okay. Can you please
calcium
tell
less
me
than 2 milligram per liter. Yes, ma'am.
why the patient with acute pancreatitis presents with hyperglycemia?
Yes, ma'am. There may be damage of pancreatic beta cells and decreased release of insulin, and there may be sepsis that will cause further hyperglycemia.
Okay. Can you name two conditions when you have to consider acute pancreatitis when uh, serum amylase turns out to be normal?
Yes, ma'am. Serum amylase has a very short half-life, and it may turn into normal within 48 hours of onset. Uh, uh, in uh, in late presentation, there may be normal serum amylase.
Okay. Why do you think this patient is tachypneic?
Patient may be tachypneic due to pain. There may
And
be peripancreatic collection.
yes,
Uh,
right. What is ARDS? Can you
Maybe
please
due
tell
to
me?
ARDS. Yes, ma'am.
Yes. Can you
Maybe.
define ARDS? When can
Uh,
a patient with acute pancreatitis present with ARDS?
Acute respiratory distress syndrome. May I tell the pathogenesis now?
You have to tell me in which, how or why it happens or
Uh,
it results. It's one of the complications of acute pancreatitis.
yes,
How does it
ma'am.
result?
It may be sequelae of acute pancreatitis.
Yes,
Uh,
yes.
Ma'am, past time I can return
Okay.
back.
Can you tell me how would you take care of the nutrition of this patient while considering
Uh,
patient is suffering
And
from?
in case of nutrition, I will first keep the patient into, but I will try to start the feeding as soon as possible, and
How?
most likely I
Through
will ensure nutrition by enteral feeding,
enteral feeding. Okay.
most
Why?
preferably nasojejunal feeding.
Okay. How would you calculate how much nutrition patient needs?
Uh,
All right. Okay, we'll come back to this later. Can you tell me how would you manage the pain of the patient?
I will manage the patient's pain according to WHO guideline. First,
According to, yes, WHO's pain ladder. Yes.
step pain ladder.
Yes.
First, by non-opioid drugs like acetaminophen, but
Yes.
I cannot give any NSI. And then with opioid, if not controlled, I will give strong opioid, and if further needed, patient control analgesia and
Can you give me one example of a strong
epidural.
opioid that can be given?
Strong opioid, I will give pethidine.
Okay. What is the difference between pethidine and morphine?
In case of morphine, it will be metabolized more by hepatic pathway.
Okay,
And
can
that's
you
why
tell
morphine
me,
cannot be
Bell is
given.
gone, but last question, can you tell me what are the disadvantages of giving or managing pain through PCA, patient controlled analgesia?
Sorry, ma'am, once again.
Yes, can you name two disadvantages of managing pain with PCA, pain control analgesia?
Yes, ma'am. In case of PCA, first of all, it is operator dependent, and if patient is not fully conscious and aware of the procedure, of patient control anesthesia, then it cannot be given. And
Secondly, it's battery operated. If
it's
battery
better.
runs out,
Yes,
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 then it won't be sufficient. Like you'll
it,
be,
it won't function. Yes.
yes, it won't be functional. Okay, good. Thank you. Right. So, question.